Good evening. I'm Chris Bury.
And I'm Barbara Pinto. Tonight, an in-depth look at how the new Affordable Care Act is working in Illinois.
The battle over health care reform has led to a government shutdown that has already left thousands of federal employees in our area out of work.
Meanwhile, millions of Americans searching for insurance are jamming the online marketplace, including tens of thousands here in Illinois.
While there are many frustrating glitches, some who've struggled to find insurance before have finally found a safety net.
So this would be the first page that you would see when you come to the website.
59-year-old Will Wilson of North Suburban Highland Park is logging on to the new online health insurance marketplace. Just a few clicks and he ends up at the federal website, healthcare.gov.
Click on the green bar, green for go, apply now. And you can go. So because it's pretty busy this morning, this is what comes up.
Wilson encounters what many have complained about, a busy signal. Many Republicans in Washington, critical of the Affordable Care Act, say the computer glitches prove the program is too cumbersome to work. The Obama administration says the computer problems are merely growing pains and that the online healthcare marketplace is proving popular with millions of Americans. And Wilson says history suggests a little patience pays off.
2 months into the Medicare rollout, they were saying, oh, this isn't going to work. And 40 years later, people can't live without Medicare.
Despite the computer hang-ups, Wilson was among the very first in Illinois to take advantage of the new insurance market, logging on at 3 o'clock in the morning. After being diagnosed with AIDS 12 years ago, he found out his insurance policy at the time did not cover much.
I very quickly started having to pay things out of pocket, and within a year, I was about $150,000 in debt.
That forced Wilson into bankruptcy, and his pre-existing condition left him unable to get private insurance. So he found help under the Ryan White Care Act. It covers treatment for his AIDS, including special drugs that cost $3,500 a month.
And the thing about HIV is that those drugs are imperative. You don't have them, you die.
But in order to keep that Ryan White health care benefit, Wilson was not allowed to earn more than $33,000 a year. So he toiled away at jobs that paid very little.
You know, I have a couple of college degrees. I mean, I'm pretty well educated. I could earn a decent living, but the question came, do you want to make money and get sick and die? Or do you want to be poor and have health care?
59-year-old Gail Weiss of Chicago also turned to the new health care exchange. She's been living without medical insurance for about 15 years.
I'm frightened to death. I mean, it's very frightening.
Gail has tried to buy health insurance but can't because of her rheumatoid arthritis, a pre-existing condition.
Just the diagnosis of rheumatoid arthritis from mild above causes insurance companies to completely deny you insurance coverage.
Insurance companies that denied Gail coverage directed her to the state-run high-risk plan, but she simply could not afford those premiums.
And I did inquire, and it is true, they have to insure you. However, they don't have to make it affordable. And they wanted over $800 a month to insure me, and that's more than my mortgage payment.
Gail has been trying to log on to buy insurance in the new healthcare exchange since October 1st. But keeps getting the busy signal. Still, she's not worried. She already has plans for what she's going to do once her new insurance coverage kicks in.
Well, the first thing I'm going to do is I'm going to go to the doctor.
Will Wilson bought new health insurance online, a bronze plan with a deductible of $2,000. It covers doctor visits, hospital stays, prescriptions, immunizations, and more for a monthly premium of $325. He says that will allow him to pursue a better-paying job without fear of losing coverage for his life-saving medications, giving him, above all, peace of mind.
There are so many freedoms that I'm going to have regarding health care.